morning.
Good morning.
Welcome to our Sunday 11 o'clock share. My name is Dr. Eileen Yue Ling Han from the Academy of Acupuncture. And today I'm very happy to invite Dr. Bonnie Robinson to join us. She is currently right now at the Victoria, Canada. Victoria, where in Canada? Alberta?
British Columbia.
Oh, sorry.
Okay.
I just moved your country. British Columbia. So let me introduce you who Dr. Bonnie is. Hi, Dr. Bonnie. Just say hi. And I'm
Hello. Hello.
Perfect. Now, let me introduce you who Dr. Bonnie is. Throughout her story, personal and professional journey, Dr. Bonnie Robinson has always loved the idea and practical aspect of the caretaking. Yet, it was her first interaction with an acupuncturist to clear up her unresolved teenager agony that sealed her fate in Chinese medicine. After study with her first acupuncturist master, Joseph Wen Ten Wu, she enrolled at the International College of the Traditional Chinese Medicine, Vancouver in 1991. She graduated in 1994, opened her full-time practice, and not stopping expanding and growing her expertise since then. The turning point in her TCN experience was meeting Dr. Richard Teffutin in 2004, whose incredible wisdom she treasures to this day. She is part of the Balanced Method acupuncture community and feels lucky to be able to continue Dr. Tan's work, loving, intent, and masterful method. Let's welcome Dr. Bonnie Robinson. Yay!
Thanks, Eileen.
Great. So, for all this about who you are, tell us a little bit about you and where you practice and what else you like to do. Qigong, Tai Chi, and I know I love one of the things that you do is you always testing me if I can drinking wine or champagne or scotch or vodka that will, instead of crash my liver, and this one will tonify me. Tell me everything about it.
Oh, well, it was some electrical muscle testing that we were doing to find out if on that particular day it was a great idea for you to imbibe it all, or whether wine would be more appropriate or beer would be more of a challenge. Or so sure, electrical muscle testing can help individualize a treatment or an oral intervention or dietary choices for sure. Yes,
Yeah.
that I had to use.
On top of the Balanced Method, you do that for your patient too. I think I noticed that. Yes. And then tell us about your Qigong, Kung Fu practice and all that.
Sure. Well, Tai Chi and Qigong, I mean, Taoist Tai Chi I was doing for years. Lately, I now work on Saturdays, so my main class is not so available to me. But I studied Qigong originally, the animal postures with Master Wu years and years ago. I still actually really enjoy drinking in the yin energy of the moon on full moons.
So will you be able to text everybody when to start at the full moon, the yin time, so we can all enjoy it at the same time with you? Why not?
Well, the only trick is when the full moon is out, it's dark, and what I'm going to be doing is not so easily videoed, but one could demonstrate it, but it's actually pretty funny to look at. So, because you literally are
drinking like that?
In the yin energy of the moon. And then there's this posture that's almost impossible. You're arched way back, and then you're going to swallow that bolus of yin down, and when you're in full extension.
Wow.
Yeah, it's just one of the many things in the Kung Fu.
I think we should have some classes for that and recorded it so people can watch it and start practicing it. And then after they start practicing it, so we can get all the people together, so you can give them a little pointers. That will be another good stuff for us.
Oh, there's lots of people teaching Gong Fu for sure. Yeah.
Great. So now I like to have every one of you, whoever join us on Facebook or Zoom, please tell us where you're from. I know Norway. Oh, hey, Lars already know where he's from. We have people from Norway, and we have Costa Rica, and we have where we Hiroko. Where are you from? Sorry, Texas. And Christine, where are you from? Dr. Antonio, oh, Ismail from India. So you're all over the places, and Miami Beach for Roberto, and Lindsay and Eileen Way from, one from Calgary, one from San Diego. That's Lindsay. And also, who else? Anybody else is coming up? From Belgium, Lawrence. If I pronounce your name wrong, sorry. Yes, thank you, everyone. Please, please, please just say hi to us and let us know where you're from, so we know we're broadcasting this for all over the world. So all the people from Balanced Method family is part of this Sunday share. I know it's going to be a different time, but you can watch now, you can watch later. Thank you so much from everybody. Hiroko from Canada. Great. Oh, same as you. Great. So tell us, how did you find out Dr. Tan at 2004? That was a long time ago.
It was a long time ago. We have an annual conference in Vancouver called COMS, the Canadian Oriental Medicine Symposium. And Dr. Tan was one of, 5 presenters on the Saturday morning. And he had 45 minutes to share whatever he wanted with us, and then the next person and the next person. Well, after Tan did his 45-minute presentation, when Wu Ji and then yin and yang and so down to the 8 trigrams, he had me totally hooked, and I think he had all 350 people in the room mesmerized.
Wow.
The organizer, John Stan, knew he had a problem because the way the symposium is set up, in the afternoon, you spend 2 or 4 hours with one of those people. But that weekend, if you chose to follow Dr. Tan, you would only see Tan all of Saturday afternoon and all of Sunday afternoon, which means you would get nothing from anyone else. Well, there's no room big enough in the hotel for everyone to do a breakout session with Tan. So John quickly went and spoke to Dr. Tan and asked him if he could come back that year, which he did in November, so that John could ensure that, there was a smattering of people at various presenters rather than the whole room with Dr. Tan all weekend. So Dr. Tan came back the following November, and I'll never forget that first day, because after just the one full day with him, I went back to my friend's place. I was no longer living in Vancouver. She was having some friends over for dinner, and he had chronic shoulder pain. And I thought, well, do you want me to put a couple of points in? I just was doing this class. I put 4 points in the liver channel between, say, all around liver 5, say, plus and minus, everywhere where his eyes got huge. And his pain was gone, and the chronic pain never returned. Done. I was like, one day, okay, I need to study with this man. This is the real stuff. It's not like I hadn't been successful in 12 years of practice, but this was phenomenal, truly phenomenal work.
Wonderful. Then what happened? Did you follow him around, become a fan?
Of course. I followed him to Denver, to San Diego, to Seattle, to Vancouver several times, back to San Diego, that 4-day seminar, and then to his clinic, because he not only had more courses to offer so that you'd get past just the very basic 1, 2, 3, but you could get into more deeper level work with seasonal balance or with 5-element balance And then, of course, you sucked me in 2018, right? When Eileen calls me up and goes, hey, are you going to come to my level 1 course in Vancouver in a couple of weeks? I'd love you to join us. So I came and did that course with you, found out fabulously about your new venture doing humanitarian work, and very happily joined you on that trip to Costa Rica, met Antonio and all his veterinarians, but also found out that you were starting the Batsa.
Yes.
And so, as you well know, there I was dressed for Costa Rica in February, going straight to Toronto.
Yes.
Yeah, to freeze myself. But anyway, it was fabulous. I did level 1 in Toronto. We did all the rest in New York, and it's truly amazing. If anyone wonders if there's any true utility to the Batsa, trust me, you will not be sorry that you did that class. You'll be able to treat people at a level that you didn't even know was possible.
Yes.
Yeah.
So are you going to give us a case study? Is something to do with the Bazi plus the acupuncture balance method?
Sure I can. Sure I can.
Okay, not now. I have more question for you.
Sorry.
All right. So you came here to San Diego to follow Dr. Tanya in his clinic.
I did indeed, because I wanted to spend more time right with him. What was he doing? Was there a way that he was applying what I was understanding him to mean in a way differently than what I was doing? So the more time you can spend in his presence, the more information you get. Just like what Jim Westmoreland was saying in your interview with him, that yes, there are fine refinements of the theory that you can learn, but it's the skill of the master that you're trying to absorb by osmosis, by being there, by being within his field, within his aura, so that you can understand exactly what he's doing. Absolutely. And I should have done more of it, but one gets busy in one's own life, or one thinks that's most important. So distractions abound, of course.
And I really appreciate you show up at Dr. Tan's clinic, because you raised questions that I thought is normal, because at that time I was a student already there practicing and apprenticing with Dr. Tan. And I remember you came in and you saved my life. Basically, why saving my life? This is important because you have to have a sharp eye so you can see what Dr. Tan is doing. So after one patient that is really special treatment, and Bonnie came out the room, and then she asked me, because I was in the room too. So she very low voice says, Eileen, did you see what the Tan do? Is it the yin or yang? Is it one side yin, one side yang? I was like, what? I see this treatment every day. What are you talking about? Yin yang, right? And she says, well, try it again. Take a look so you'll know. I was like, okay. So I went in there and I double checked what Sifu did. Oh my God. Yes, he did it one side all in and one side all yang. And I was like, oh my God. If not because of you're there, I was still thinking he's doing something crazy. Just putting 5 needle on each one of the Jingwell points. Right. I don't even know the yang or yin. That's amazing. Thank you for that observation. And now I learned how to be a very good observer. Everything you need to learn. It's not just like people would say, you learn from osmosis. I learn from you too. Everybody has something that we can learn from. And I want to thank you. Since then, I think there's a 2008 or 2009 you came to the clinic.
Yeah, it was probably 8.
Yeah, so
8 or 9.
So since then, I practiced how to be a very good observer. Right. Oh my God. Thank you so much. You have no idea. Oh, you say
pleasure. Absolutely. That is one of the bonuses of being in his courses as well, is even if he's not teaching, we're interacting with other students who are also as keenly absorbing this information and have slightly different ways that they understand or apply. And so we're sharing information all the time.
Yes. Yeah, this is so awesome. I can't. So tell us the reason why you follow him around. Just only by osmosis, not something for drinking. Although you don't even drink. Oh, you do drink.
Salsa dancing. What do you mean? Salsa dancing in La Jolla. Woohoo!
Oh, that's right. You did. You went. You see, Dr. Tang has so much fun with salsa dancing. We're drinking. We're eating good food. Every dinner every night we have great dinner.
Yeah, absolutely. Absolutely. And besides, you can do acupuncture by stepping on your teacher's toes while you're salsa dancing with them as easily as with needles.
Absolutely.
Yeah.
Great.
So one of the beauties, as I say, is besides getting refinement by repeating courses, Tan was still developing and gleaning more information from the classics. And while I was studying with him, he hadn't started teaching Batsa in the mid 2000s. That came later. So to be able to continue to follow him as he proceeded to glean more and more from the old classics, it's just a more and more profound experience. And as was Batsa, studying with Christian, brilliant instructor doing a fantastic job, I thought, of presenting Tan's work with Batsa.
Yes.
Totally practically applicable.
And I also like to share that with you. Bonnie, Christian, they're all in our WhatsApp group. And sometimes they check, sometimes they don't. But those are all our senior student from Dr. Tan, which also the leading force of the balance method. They're all in the WhatsApp group for your convenience. So if you are in a WhatsApp group, please, sometimes if you have questions, you ask them, they usually will give you a great answer. And Tona also in there, Jim Westmoreland, Martin, Gord, they're all there. So the community is here. Please, if you have a chance to use them, don't abuse them, but use them. And whenever you come to a seminar, if you meet one of those people, please go up and say hi. So they will be happy to say hi with you and talk about acupuncture balance method. They love balance method. So I'm not the only one here. So you have a family, which is a balance method family to join with. Okay. So now it's time for you to share the case study with us. I'm so
Okay, sure.
excited. Please tell us the story.
Sure. So last summer, in the midst of finishing the Batsa courses, we're between the third and the fourth level. I had a client come in July who'd had bad pain and burning in her urethra, 10 out of 10 on the scale. And she'd had this pain for about 4 months. She came in and I did one of Tan's classic treatments, using pericardium 7.2, et cetera, to image the area. And she got pain relief, no question. And in fact, she was joking with me before I treatment that did I mind if she was moving in, because my recliner was the most comfortable place she ever found in Victoria in the last 4 months. But the odd thing with this was her pain came back almost as soon as I took the needles out.
What?
So I've been studying with Tans for 16 years. I've been doing acupuncture 26, and I've never had that problem. And her pain just came right back. So I communicated with Christian about this. We were gathering case studies. I wanted to use her as a case study. It was nice and deeply complex with interactions with her husband, who she worked with all the time, et cetera. And Christian sent back a treatment for me for her. And I got in touch with her to say, hey, yes, you're going to be the case study I'm going to use, because she was hoping, because we weren't getting lasting results. So she was all excited. And then the next day, Christian sent me a half-hour video explaining a better, more elegant treatment. And I took an hour and a half of notes off that half-an-hour presentation. Yeah.
Hold on. Are you talking about he using the Bazi, the astrology, the 3 essentials?
Yes.
To figure out some details for that? Can you?
Yes.
So
because we hadn't studied Kongwan. So we hadn't. The Kongwan is the ghost points that the not the ghost points, excuse me, the void points. So some of the points I was doing for her primary pain area for her chart were actually either neutral in effect or negative effect, a
Ooh.
counter benefit effect. So I not only needed to eliminate those points from the treatment, I did her chart, we came up with a treatment that completely avoided any of those void points, the Kong 1 points, and created a treatment that I then did. And when I saw her the very next time, 3 days later for treatment, she had no pain. I did one treatment. She had no pain after that. And she wasn't happy or excited. She was confused because she's a receptionist for a chiropractor. She said, I know that chronic pain doesn't just go away. She said it takes some time, but my pain has gone away. And I said, but you're okay with that, right? And she goes, well, yes, of course, but I'm just so confused. My head can't keep up with it. So she was very pleased. I think we repeated the treatment a few more times. But as I say, when I feel sheepish, because I remember Tan very briefly discussing Batsa back in 2008, saying when he was working on this with some people doing some readings, and I had no clue of its utility, certainly no clue of its practical utility. And that's one of the beauties of working with him again and again and going deeper and deeper, is you can have that benefit for basically everyone you meet, even the most difficult people, the most difficult cases. You have plenty of depth in your toolbox once you've gone deeply with the 10 balance method.
That's awesome. So that is a Kong 1 point that you eliminated.
So I ensured that the Kong 1 point was not there. And then I did a 5-element balance within having been informed through the Batsa chart of what would be most balancing for her particular chart. And it just worked immediately.
So you move away from pericardium 7.2.
Oh yes, but there's a whole constellation of points because I needed to come up with one hexagram that would balance her entire chart. And
Got
so then
it.
the points that we used were entirely informed by that one hexagram.
Got it.
Yeah.
So
And so we had to make sure that that hexagram had to ensure that when it was done, pericardium 7 was nowhere near in it.
oh.
Because it was actually not neutral. It was definitely having a negative effect.
So the 5-element method from the Dr. Tan's balance method are more of tonifying or more of the sedating?
But it was the 5-element within the Batsa. It wasn't his regular
Oh,
5-element balance.
got it.
Yeah, it's using the 5 elements, and whether the chart was Shenro or Shenchang, in order to ensure that the maximal balance. What was void, which elements were void, what's the best way to balance that chart. And it was phenomenally effective. Yeah. So no, it's brilliant. It's brilliant. So I was tickled when Harmon Mesker was, you brought Harmon in the beginning of the year, March, and started the I Ching.
That's the I Ching seminar. Yes,
Right.
we are going
So
to
yet
have
another
that.
level.
We're going to have that starting as a home study online program. People can purchase the classes now online, and it will be formally announced next week for our online courses. So yes, that particular seminar is also going to be able to watch over the internet and online on demand. So I'm very excited about it. That's one thing. The second thing is I like to put this into our today's interview is our Bazi seminar. The next cohort is already starting next year. It will be starting from the February 2021, and we have also 5 levels. And all the schedule time is already there available online. So if you are interested, please go online and check the link that we're going to post it right now. So you will have the link to know where is the our 八字 seminar 3 essential will be teaching by Christian St. Pierre. So for this, that we will have welcome all of you, whoever is already study balance method. If you are not studying balance method, is it also okay? Or you're only a beginner, you can still also study the 3 essentials. That is not a collation, it's not one after the other. The curriculum can be all parallel to in the same directions. So that is wonderful.
Eileen, can I offer one other example of the power of Tan's work?
Yes, yes, please.
So so sometimes, not a lot of the time, but sometimes I get people who don't live in Victoria who ask for a treatment. And in fact, this particular person did live in Victoria who called me, but she was in the hospital because she had a uterine fibroid that she'd been taking some Lupron, a drug to try to shrink the attachment, the pedicle of the fibroid, so that when they did surgery, there'd be less bleeding. And before they succeeded in getting her ready for surgery, her body went into labor.
What?
Her body went into labor in the attempt to deliver a fibroid that was still attached to her uterus.
Wow.
So she called me from the hospital and asked if I could help because she said, I think sometimes you do remote treatments. And could you please do one for me if you do?
Oh my, Dr. Bonnie, you gonna share this one? Don't, I hope there's no controversial after this video, but go ahead. I'm okay with it. Go for it.
Beauty in the end is it's all the same. Tan's
Okay.
loving intent, right? So I used muscle testing. I didn't have her there, so I checked to see if I was an accurate surrogate for her, did some muscle testing. What was the most beneficial treatment I could do for her? It was, I don't even know what the treatment was. It could well have been the cuckoo balance treatment, right?
Maybe
Julian Xiaoyang.
Jueyin Shaoyang.
Yeah.
Okay.
And so I got my plastic acupuncture model out. I lay it on my desk. I imagined I had her in front of me as clearly as I could. And I put the needles into that model as if I was putting them into her skin, and then set the model aside. And her partner called me the next day saying, thank you very much. That helped so much. Everything just settled down and calmed down, because what in the hospital, they didn't really know what to do. So, it's whether you're using needles, whether you're using acupressure. I used acupressure on a man in a hospital where he hadn't eaten for 17 days. So you couldn't put a needle in. His daughter, who's an acupuncturist, already had, and he had needle shock. So I happened to walk in the next day and I just did the whole digestive magic balance with acupressure. Done. Over. He could eat again. He could poop, so he could leave the hospital. Tan's work is phenomenal, and you don't have to use a needle in order to apply it. Many
So
ways.
you guys want to know what is the magic combo for the digestion system? I'm sure she was talking about a magical plus one. A magical plus one. So if you don't know yet, and Sean will post up those points for you guys, so you have access to it. So what Bonnie was talking about, that is the a magical plus one. So not only for needles, you can also use acupressure.
Acupressure, laser, intent. It's just, you have to be that clear is all.
That's wonderful.
Yeah. But it's thanks to Tan and his work and the clarity of his ability to communicate it to us all that we've been able to use it so well.
Thank you. Thank you for sharing. And I like to share this with everyone. Dr. Bonnie is really awesome. She always will give you more than you ask for. And then sometimes when you are, if I just look at her, sometimes when we were in Costa Rica, I was like, what are you doing? So I just have that big eyes like this. She would start telling me, where does that come from? Why is that come from? How did you do it? How can you train it? And she is such a loving person, and she love to help you and take care of people, take care of the patients, take care of the colleagues. She's one of the person that you got to get to know her is Dr. Bonnie Robinson. And then if this is not enough for me to introduce all these wonderful people in our community, balance method community, I think you need to focus on this balance method as one of your practice of acupuncture style. And you have all these people can support you, all these people right behind you to help you, to support you. So this is very important to get to know every one of these pioneers they who are already practice balance method for 20 years. They are successful in their area. They're in Victoria, they're in Calgary, they're in North Carolina, they're in Toronto. Have you ever heard Nova Scotia? That's in Canada too. I thought that was in Europe. Apparently, I wasn't that smart. So we are everywhere. So if you're just starting to learn balance method, you're not late at all. We need 6 generation of us to be able to have the balance method acupuncture. Everyone will be practice this. Okay, everybody will practice it because it's so effective, so good results. Like Bonnie, she using Dr. Wu's. Of course, she still also have that tool in her tool belt, but she also used Dr. Tan's balance method acupuncture. How long you been practice? 30 years?
26, but I seldom do anything but 10. Occasionally, but very seldom. I mean, it's funny when in the introduction it said it changed or informed my TCM practice. I gave up my TCM practice. I don't do TCM acupuncture to ever. No.
So tell us where you practice, where in Victoria?
Oh, I'm just on the edge of downtown Victoria, so it's nice and quiet, and you can have your treatment outside or you can have it inside. I try to create, I call it the sanctuary, because most people, of course, as we all well know, if they feel comfortable enough, they'll share more. And we don't need all the detail, but we need to know the emotion connected to the detail. We need to understand the depth of hurt. Yesterday I was seeing a client who I've seen many times before, but only because her husband had just had a stroke and is now urinarily and bowel incontinent and needs 2 people to walk him. She's feeling badly because she doesn't want him to come home because she nursed her young boy when she was pregnant with her next child until he died. This woman had to wake up every night and suction him several times a night because he couldn't swallow his own saliva. So this woman is on edge, waiting to go, like, should I get up now and do the suction? Because, maybe she hasn't told me any of this, but I got it. As soon as she said, oh yeah, I know this. I've been a caregiver. I looked after my son who couldn't walk, couldn't swallow. And it's like, right. I know why you can't sleep. I know why you got caught by the you dream conspiracy of it supposedly being herbs and that's how you sleep. You need to down tools. You've been in a fight or flight since that boy was at risk of drowning in his own saliva.
Oh my God.
So the more comfortable people can be, of course, the deeper you can work. The more information you get, the deeper you can work. And that's what we're trying to do, right? We're trying to alleviate suffering, or that's what I'm trying to do.
Right. So today, for all of us, please send the good energy to your patient to hopefully that she will be able to feel better and her husband can recover sooner. So he will be able to do all this treatment. Maybe we can ask your help to have a surrogate treatment to help him, to help her. And well, you have to ask permission, I'm sure. So yeah, though it's just every one of us, please let's all pray. I don't know what your believing is, but we all send a great energy to help this person and the family to have a great results of their health and improving and having a great results for all the illnesses, and they are all going away. Thank you so much for sharing this case with us. Yes, sometimes right now the illness is not only just the physical anymore. The illness is usually right now is more a lot more of mental, and especially right now in San Diego also, because we're so much effective because by the COVID-19, and people gets to be very jittery, and then they just cry on my table, and everybody are freaking out for little things. Oh my God, where is your mask? Is very different now in California. I know there are many places already clean from the COVID, but it's just still going here. So even our president had have the COVID right now. And
Yeah.
as I always said, the 八字 of the president of our president, hopefully he will be surviving. If he can survive in this trouble time, the trouble condition, and he might be okay. So I would send him a prayer too, since he's still my president. Okay, no matter you like him or not, he's still a human being. So yes, because of our doctor, we save everybody, right? Good. So
Absolutely.
yeah, thank you, Bonnie. I know you
Thank you,
guys
Eileen.
Canadian watching our election is soap opera, but
It,
we are closely related. Give us some good energy, please.
well, of course we will. Of course we will. You make me think of the old Hawaiian peace and reconciliation. I can also speak English. Reconciliation method called Ho'oponopono, which
Yes.
is something that is not, I mean, sounds like a prayer, but isn't necessarily a prayer because, again, it's just shifting energy. Its purpose is to allow you to help shift something from your energy. And so, as we use, as Jim Westmoreland so aptly said, we have the unified field theory in Chinese medicine. So we know that if we can shift something from our microcosm, we can help shift it from the macrocosm. It's not just top down. So that's what Ho'oponopono is doing. So that it very simply goes, I'm sorry, please forgive me, thank you, I love you. So if I was doing this for the American election, I would be, I'm sorry for everything in me that resonates with any of the, uproar and craziness that may prevent an adequate and a fair election proceeding on the 4th of November. Please forgive me for these things. Thank you, I love you. And then thereby, I can't impact anybody who's going to vote there. Nobody can. But if I can help shift the energy around it, then perhaps we can still have an effect. And it doesn't matter what you're trying to impact, you can use that word.
Yes. Thank you for sharing that. Hono.
Ho'oponopono. Ho'oponopono.
Sean is typing here on the Facebook.
Or you can
So you guys can Google it.
YouTube Dr. Hugh Len, Hewlen, the name of the Hawaiian man who's currently practicing this. Has some good YouTube interviews.
So yes, we're all gonna practice that. We're gonna help each other with great energy. So this time's up for our interview. Thank you, Dr. Bonnie Robinson. She's also part of our WhatsApp group and also on Facebook. So please connecting with her. And also, and Dr. Antonio, all your veterans colleagues from Costa Rica, and I'm sure Dr. Bonnie saying hi to all of you. Say hi.
Indeed. Hello to all our Costa Rican friends. Absolutely.
And we will see each other very soon. And hopefully we can go to Costa Rica again very soon.
That'd be great.
All right. Thank you, Dr. Bonnie.
Thank you, Eileen.
Thank you for coming. Have a great day.
And
Thank
you.
you, everyone. Have a great day.